Are you trying to make sense of the bariatric diet now that you've had surgery? What are sugar alcohols? How are they different from sugars? Should you consume them, or will it not be pretty if you do? Coming up, let's clarify the differences between added sugars and sugar alcohols and what that means for you.
ProCare Health offers easy and affordable solutions with once-daily multivitamins, including our new DS and SADI surgery formula, increased iron, A, D, E, and K. Still just one capsule a day. Visit ProCareNow.com and use code Susan60 to get a free bag of protein powder with $60 purchase.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 89. I'm here to help you cut through the health hype and give you accurate, evidence-based nutrition information worthy of your time and all your efforts. Simple, step-by-step strategies that can change your life today. I want you to feel well every single day. Get out there. Do the things you want to do. This Bariatric Surgery Success podcast is for you to help you do just that. You've got this. Are you benefiting from the podcast? If so, would you take a couple of minutes to rate and review it on Apple Podcasts? Just find the Bariatric Surgery Success podcast on Apple Podcasts and look for where you see ratings and reviews. Okay, yes, I'd love a 5-star review. But just be sure and let me know what you love most about the podcast. It's really helpful. Thank you. Well, have you been told no added sugars after surgery? At least not for a while. What about sugar alcohols? Are they the same thing? The big question is, can you consume sugar alcohols after weight loss surgery? The quick answer is, maybe, but I hate that answer, don't you? The bottom line is that you might tolerate these sugar alcohols without any issues, or you might be sensitive and have gastrointestinal effects similar to dumping syndrome. So let's look closer, talk about why I say maybe yes, maybe no. Okay, I'm serving up a short sugar review in today's Science 101. Sugars are carbohydrates with that sweet taste that we love to hate. Made up of carbon, hydrogen, and oxygen atoms, they convert to energy in the body. Natural sugars are found in dairy products, think lactose, also in fruits, veggies, and grains. And sucrose, commonly known as table sugar, is just one of the popular added sugars found in many food products. So what are others you can think of? Yep, you got it. Honey, maple syrup, corn syrup, agave syrup, coconut sugar, brown sugar, and more. Added sugar has calories, right? Any of these added sugars have calories, but zero nutritional value, meaning they're not a source of vitamins, minerals, or naturally occurring plant nutrients that benefit the body. Sugars contain about 4 calories per gram and can rapidly affect blood glucose levels depending on when they're eaten and what they're eaten as a part of. So after surgery, these sugars are also the menace behind dumping syndrome. Okay, before I forget, I have a freebie to help you sleuth out the added sugars on food labels. So be sure and download it when you have a moment. I'll put the link in the show notes. Did you know that added sugars are basically empty calories, meaning they have zero nutritional value, as we just said? But they're often added to food and as flavor enhancers and preservatives. Their carbohydrate-dense nature makes them a trigger for dumping syndrome. What about sugar alcohols? Well, also a carbohydrate, also sweet tasting, but with a different chemical makeup that resembles both sugar and alcohol. Okay, stop right there. No. Sugar alcohols do not contain ethanol, so they're safe if you're avoiding alcohol. Your body doesn't absorb sugar alcohols as efficiently as added sugars. In fact, they're slowly and incompletely absorbed from the small intestine into the bloodstream. Various sugar alcohols are also added to processed food items, just like added sugars, but they have fewer calories. Still zero nutritional benefit, same as added sugar. So mainly just calories. Remember, sugars contain how many calories per gram? Right, 4. Sugar alcohols contain about 2 calories per gram. And they're also found in some fruits and veggies naturally as well. Apples, plums, peaches, strawberries, bell pepper, avocado. And sugar alcohols are also made by processing regular sugars. You've probably noticed sugar alcohols such as sorbitol and mannitol added to various products like chewing gum or candies, ice cream, toothpaste. Since they're not well absorbed, if you consume a lot of sugar alcohols, they can cause bloating, gas, stomach pain, diarrhea. And I hope you're asking, well, how much is a lot? Recommendations suggest 5 to 20 grams total per serving. So this really varies with surgery. So it's a good question to ask your bariatric dietitian about your specific situation. Start out with a small amount, down around 4 or 5 grams, and see how your body responds. Get in the habit of checking your food labels. Look at the ingredient list to see if any are listed. Sorbitol, mannitol, xylitol, erythritol are more common ones, and each may affect you differently. Add them slowly, and remember, less is more when it comes to using them without side effects. Also, check the nutrition facts label in the U.S. and see if sugar alcohols are listed under total carbohydrate. If a claim is made on the label such as sugar-free, you'll see the sugar alcohols listed there. The Food and Drug Administration, or FDA, in the U.S. has a terrific interactive nutrition facts food label that shows sugar alcohols and where they're located on the label, so you can become the sleuth I want you to be. I'll put the link in the show notes. It's very cool, so check it out. Remember, knowledge is power, and the more knowledge you have, the better your journey is going to be. Have a great week. Take care of yourself, because you're worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell, or Practicalories, LLC.